Namaskar. Welcome to Dialogue with Divakars. I am Dr. Hema Divakar, obstetrician and gynecologist from the Divakar Speciality Hospital at JP Nagar, Bengaluru. Let's discuss about having sex or intercourse after you have had your hysterectomy or the uterus removal operation. Many women who are having fibroids in the uterus, who may have cancer of the uterus, who may have very heavy, painful menstruation, who may have conditions called adenomyosis, a variety of reasons why your doctor would have suggested that you should have your uterus removal operation. But then you are hesitant because you think that removing your uterus may play a very major role in your sexual activity or performance, and you may not like it yourself, or your husband may have questions about this, but you are still not very comfortable asking your doctor about this. But be sure to discuss this issue with your doctor, because the primary problem lies in your uterus. Uterus and cervix are being removed. The vaginal area remains as normal as it could be even after the surgery, and within 3 to 4 weeks after the surgery you can resume the normal sexual intercourse. At times there may be small issues like vaginal dryness or slight pain when you begin the intercourse, but this is never ever a major problem. So having the fear that having hysterectomy may interfere with your sexual activity and refraining from agreeing to this operation and struggling through the variety of problems that you have is not quite correct. So please do discuss with your doctor about how soon, how often, the do's and don'ts related to your sexual performance even after menopause and even after major surgeries like hysterectomy.